Michelle, and good morning, everybody. So Keith Coker from the Medic Coordinating Center, one of the medical directors, and I'm going to cover two topics here. One is kind of a standard that we always do in each meeting, which is performing, kind of an update overview of our collaborative performance. And then I'm actually going to also talk a bit about the stroke program that we're developing as well. Um, so what's different about the collaborative performance updates now is we get to talk about kind of the summary achievements for the last performance year. Um, Here's our standard dashboard, just kind of a sense of the big picture. You get a sense of the kind of book of business around all of our quality measures, when we started them, the aggregate performance over a year. Just recognize, there's some nuance here in terms of interpretation as sites join who may, be at different stages of improvements, but nevertheless, you get a sense of sort of the big picture. I'm going to talk about VBR first. VBR is the value-based reimbursement program. This is the one to incentivize physicians, physician groups. We had three measures for 2025, adult head injury, pediatric head injury, and pediatric respiratory chest X-ray. Um, and great news is we were successful across all three. For those groups, those individuals that were performing VBR or participating in VBR in 2025, congratulations, you'll get the bonuses that accrue to that. Um, not every site is or group is able to participate until you've been in Medic for at least a year or two to be able to have enough data available. We do list out kind of the month by month in the slides. I'm not going to go into these details, but these will be available to you in the slide deck. Um, Also, just a note, this is a voluntary VBR program around smoking cessation counseling for COPD patients in your emergency departments. Not everybody participates. Like I said, it's voluntary. There are different ways to achieve success here. I think also good news is my understanding is all sites that were involved in this program were also successful. So you will also see the bonuses associated with this particular voluntary VBR program as well. And then I wanted to cover a couple things in the P for P program. So this is pay for performance. This is the hospital-based incentive program. There are different components of this within the annual scorecard. So there are some site-specific measures as well. And I'm not going to cover those because those are very specific to each individual site. But wanted to note the collaborative-wide measures, and we had three of these. Chest X-rays in pediatric respiratory conditions, naloxone, and then pulmonary embolism diagnostic yield. We were successful on two, not successful on the PE measure. Just a little kind of big picture here. There's certainly, pros and cons around aggregating everybody into a single measure. In part, this is a structure that we are required to have within our scorecard from Blue Cross. As you know, we work with the executive committee every year to figure out what those targets should be. We were certainly very close on the pulmonary embolism one. You would think, 8.4% relative to 8.5% is really close. But the truth is, we do a lot of these chest CTs annually within Medic. So despite being 0.1% close, we're actually 700 CT scans away from actually achieving that. We've certainly heard a couple email outreaches from sites. We're happy to take questions about any of this. If you have some, please reach out. And for what it's worth, on the pulmonary embolism one for 2026, we're actually had lowered the target from 8.5% to 8%. So should be more achievable for the 2026 target. We did include in the slide deck the month-to-month achievements. Again, I'm not going to get into these details here, but they're available in the slide deck. And then we want to give you a little bit of some context about how sites performed on the scorecard. So this is actually the 2024 performance. So last year's, each block represents a MEDDIC site. And then in orange is the average performance. The total that you can achieve is 100%. That's perfect. So for last year, the average performance at the site level was 87. And then here is the distribution for 2025. Again, each block is one site. We have more because we had more enter into MEDDIC in 2025. The average is actually a little bit better than it was in 2024 with an average score of 89. Again, happy to take questions about this. Reach out to us with any.